All right, guys, here's the main question. When it comes to head injuries, what's the most important thing? Healthy neurons. How do you keep these healthy neurons? Well, let's break it down to the simplest of forms here. To have a healthy neuron, you need activation, so you need to stimulate the neurons. You need proper glucose, okay? And you need proper oxygenation. So if we break these down a little bit more into details, the first thing in terms of oxygenation. So this is why it's common or usually good practice to have some blood work done to make sure that you have no factors here that are off that would lead to either inaccurate oxygenation or inaccurate blood sugar levels. We really want to make sure at that kind of that systemic level that everything is looking good. Now, once that's taken care of, the second thing that you want to consider is in terms of, are you eating the right types of food? Okay, so you always want to make sure that you're eating the right amount of food and also the right types of food so that you're giving your brain the proper nutrients it needs to thrive, to kind of reduce that inflammation when kind of that initial trauma is set, to kind of make a balance for the fluctuations in calcium that kind of happen from the original injuries. You're going to want to have some things that are neuroprotective in nature, some things that are going to kind of reduce those oxidative stresses on your body. So all of those things are super important when it comes to that nutritional aspect of things. Now, in terms of the oxygenation, one of the things that's always important in terms of just general lung capacity, make sure that there's no large deficiencies there in terms of are they breathing properly or is everything in check with regards to that. Now, the cherry on top really comes when we think about the stimulation aspect. So the stimulation aspect, you really have to think that there are certain neurons that have been kind of compromised or damaged within this process. So having appropriate stimulation is really the key here. Now, sometimes certain parts of your head, they might not be doing well enough to be stimulated themselves, so that you might have to stimulate them through a process called reciprocal stimulation. So that's kind of keeping in mind the fact that every single part of your body, or your brain more so, communicates with different regions. So if a certain region isn't doing well, potentially there's another region that will kind of feed into that area that you can leverage to help push that patient kind of through a reciprocal aspect and not necessarily that centralized aspect itself. So there you have it. It's quite simple: oxygen, glucose, and stimulation. Now they get a little bit tricky themselves, but that's the main concept behind keeping those neurons nice and healthy.